Hey, welcome to The Explainer. Today, we're taking a close look at Rivas Medical Weight Loss. It's a name that's probably popped up if you've been looking into doctor-led weight management. We're going to cut through all the noise and just give you a clear, straight-up look at what they do.
You know, when you start thinking about medical weight loss, you go online and it's just so much information, right? It can be totally overwhelming. So our goal here is to strip all that back to the essentials, using our source material to figure out what this program is really all about.
Okay, here's how we're going to break it down. We're basically going to follow the same path a new patient would. First up, who is Rivas? Then we'll get into how the program actually works, what it's going to cost, check out some real patient results, and then we'll wrap up by answering some of the biggest questions you might have.
So first things first, who is Rivas? Look, with any medical decision, trust is absolutely everything. So let's start by looking at the foundation of this clinic.
So what we're seeing is that Rivas is framed as a respected, doctor-led provider. And that doctor-led part, that's really key. It suggests your plan isn't some one-size-fits-all trend, but it's a personalized medical plan from a practice that is focused specifically on weight management.
So how do they build that trust? Well, a few key things really jump out. The entire practice is led by a physician, Dr. Paul Rivas, who has more than 30 years of experience in this specific field. They have a serious physical footprint, over 15 clinics across a few states. And they seem to really lean into transparency, with things like no hidden fees, and they even handled dispensing medication right there on site, which, just makes things a whole lot easier for patients.
All right, so that's the trust factor. But how does the program actually work? What happens when you walk in the door? Let's trace that path from the very first visit all the way to seeing results.
The whole thing seems pretty straightforward, really. It's broken down into 3 simple steps. You start with an initial consult where they build your plan. Step 2 is getting your personalized medication. And then step 3, and this is crucial, is the ongoing support. Those weekly or monthly check-ins that create accountability, which is so often the key in making it all work.
Now, the heart of the Rivas model uses a class of medications you've probably heard about, GLP-1 receptor agonists. So what are these? Basically, they're FDA-regulated medicines that tap into your body's own systems to help manage hunger and blood sugar. If you understand these meds, you pretty much understand their main approach to treatment.
And that brings us to the 2 main players they offer. You've got semaglutide, which is a well-known GLP-1, and then there's tirzepatide, which works on a couple of different pathways. The big takeaway here is that both of these are presented as more accessible, competitive alternatives to some of the pricier, big-name brand drugs out there.
Okay, let's talk about the elephant in the room, the cost. It's what everyone wants to know, right? The information we have really emphasizes a commitment to being transparent, so let's take a good, hard look at what the investment is.
To give you a real solid number to grab onto, let's start right here. For the weekly semaglutide program, one of their main treatments, you're looking at about $115 a week. That gives you a pretty solid baseline for the whole pricing structure.
And here's the full menu, so to speak. Your journey kicks off with a one-time consultation for $195, which actually includes your first dose. After that, you see the weekly cost for semaglutide and tirzepatide. But notice there are other options too, like a monthly plan for phentermine and even an all-in-one telehealth bundle. It really seems like the goal here is to lay it all out on the table so you know exactly what to expect. So we've got the how and the how much, but let's get to the most important part, the results. Does it actually work? What are real patients saying and experiencing? Nothing tells the story better than direct feedback. A quote like this really hits home because it points to 2 things. First, you've got the hard numbers, almost 25 pounds gone. And second, you see the experience with the staff, which tells you that the support system is a big part of the picture.
Now, to put that into a bigger perspective, the reports show that many patients are losing 15 to 20% of their total body weight. Just think about that for a second. If you weigh 200 pounds, we're talking about a 30 to 40 pound loss. This isn't just a few pounds. This is a significant, life-changing kind of result.
And get this one, 30 pounds in 2 months? Wow. Stories like this from patients are just so powerful because they don't just point to success, they point to fast success. Seeing that kind of progress so quickly has got to be an incredible motivator.
All right, to finish up, let's do a little rapid-fire Q&A and tackle some of the most common questions people have. We'll just try to clear up any final details you might be wondering about.
Okay, let's just ask it. The question everyone's thinking, is this for real? Is Rivas Weight Loss a legitimate medical practice?
And the answer we're getting here is a pretty straightforward yes. Its legitimacy really stands on a few pillars. It's run by licensed medical professionals, has that decades-long track record we talked about, has multiple real physical locations, and a huge number of verified patient results.
Okay, this is a really important one. Any medicine that's effective can have side effects, so it's smart to go in with a realistic idea of what those might be.
The sources do mention that common side effects, especially with a medication like tirzepatide, can include things like mild nausea or some digestive changes. But here's the crucial part. The program is built to help you manage them. That's a huge reason for those weekly check-ins, to offer support and tweak things to keep you comfortable.
So there you have it. That's the Rivas program in a nutshell. The doctor-led approach, the GLP-1 medications, the clear costs, and the patient results. We've laid out the facts as they are presented. So at the end of the day, the question isn't really, does this work for other people? The real question is for you. Is taking a structured, medically supported path the right